This is Ted Mulvehill, Director of Veteran Services for the town of Norwood and Veteran Service Officer, with a brief update and a situation report and some information for you and the veterans community regarding the current pandemic we are experiencing across America today. I do have some numbers that I want you to take down, so please grab a pen and paper and be prepared to write down some of these informational numbers. They will be of assistance to you, and you'll see as we proceed with our report. First of all, let's talk about Town Hall. Municipal government is functioning. Department heads are in the building. Our office is staffed. We are staffed both physically and remotely. I am in the office Monday through Friday, and our administrative assistance is working from home with remote access to our files and information. Town Hall's main number is area code 781-762-1240. You can reach us at the Department of Veteran Services at extension 208 and 209. Now, we check those numbers frequently throughout the day. We also check our email frequently throughout the day. You can reach us via email at veterans/norwoodma, one word, .gov. And my personal email is tmulvehill at norwoodma, one word, .gov. tmulvehill at norwoodma.gov. So, Chapter 115 is one of the primary responsibilities of our department in the Emergency Financial Assistance Program that we administer. Our Chapter 115 recipients will be getting their checks as normal. I know this has caused some grave concern because we are fielding many questions about that. Now, the other aspect of that is that with the climb and increase in unemployment, veterans who were previously ineligible for this benefit may be eligible now. If you have questions, if you think you may be eligible for emergency assistance from the state, please contact our office and we will go over that information together. We are making appointments in person on a case-by-case basis, but we can certainly do our business over the phone. The issues are primarily the state requires supporting documentation, and oftentimes in this current situation we find ourselves in, that information is difficult to obtain. So, but we will work together, and I do want you to contact us if you have any questions about that. So, Chapter 115, very, very important. Online, if you need to apply for unemployment, the best way and most quickest way I was told is to go to www.mass.gov, and there's information on there on how to file for unemployment benefits. So in a very brief synopsis, that's the town side of our veterans benefits and services. Let's switch gears and go to the federal side. The VA, as we know, are, before I go on the town of Norwood side, we have initiated a call center with questions. As I said, the building is staffed, department heads are in. If you have a question with a department other than ours, assessing, building department, treasurer's office, any other department in town hall, we have initiated a call center, and you can get information from the call center at area code 781-352-2363. So that's the Town of Norwood call center for information about municipal government, 781-352-2363. Okay, that's the town side. Now let's go back to the feds. The VA, as we know, is composed of two distinct departments. The first side is the Veterans Benefits Department. The regional office at the JFK Federal Building, those offices are closed. They are working remotely, but they are working. This is the department that handles all of our disability claims and pensions and survivor benefits and paperwork. Will this current pandemic and situation cause a delay in the adjudication of these claims and benefits? Yes. The short answer is yes. There would be some delays. We don't know how substantial these delays will be. We're going to play it by ear. We're going to check in with them every day and find out situationally how they are progressing in terms of pushing these claims forward. We will do everything on our end that we can to expedite the claims and make sure that they are adjudicated in an expeditious manner. The other side of the VA that we talk about is the healthcare side. Now, this is most important because many of us, myself included, are enrolled in the VA healthcare system and have primary care physicians at West Roxbury or Jamaica Plain or Brockton. The VA healthcare side has been way out in front of this curve since the initial onset of this crisis. To that end, they have closed all of the community-based outpatient clinics across the state. The only hospitals operating now are Bedford, Northampton, Brockton, Jamaica Plain, and West Roxbury. They are taking previously scheduled appointments and pushing them out weeks. Personally, I had an appointment with prosthetics that got pushed out to the end of May. And some of our seniors who we really need to keep an eye on and make sure that they remain safe are getting their appointments pushed out as well. Now, having said that, can you go to the VA hospital? Yes. If you're in an emergency situation, you can go to the emergency room just as you can at any other civilian hospital. They will screen you. And visitors, not visitors, but appointments that have not been rescheduled, veterans will go to the hospital. They'll be greeted at the doors and entrances to the hospital and screened at that point. They'll ask you questions whether or not you have traveled outside of the United States, if you're experiencing any medical symptoms, and if you are, they'll further screen you at a different location. But most times, you're able to go into the building and proceed with your medical affairs. The VA has also done something great. They are working remotely as well. They have video teleconferencing that you can speak with a physician or a nurse. They also have, if you Google search My Health eVet, My Health eVet. A Google search of that will bring you to their portal. You can avail yourself of the opportunity to do secure messaging with your primary care physician. It's like text, only it's online and it's secure. So you can get word to your primary care physician, for example, if you need to refill a prescription or if you need further medical advice or attention. So those are two good things on the hospital side. That's pretty much it in a nutshell. There's a couple of things that I wanted to discuss with you and your families. Again, first responders are taking the forefront in this fight. We're all veterans. We were all trained to fight. And so we know how to fight and we know how to obey the doctor's orders, obey the government's orders. If they're telling us to self-quarantine or stay indoors, they're doing it for a reason. Again, I mentioned our police and fire on the front lines of this pandemic, and also now we see our healthcare professionals on the front line of this pandemic. They deserve our gratitude and appreciation and our thanks. We may not know them all, but we certainly owe them all. So let's work together. We'll get through this. We're resilient as a nation, as a town. We can do this together. We can be alone together. I want you to take care of your families, check on your neighbors, check on your friends, and stay strong, Norwood. We stay strong together, and we'll get through this. For the Town of Norwood Department of Veteran Services, this is Ted Mulvehill. Hang in there.